Fortunately, we have much better treatments for nausea and vomiting than what we used to have 20 or 30 years ago. What we understand to happen is the chemotherapy or certain chemotherapies will have a high incidence of nausea and vomiting. We actually rate these chemotherapies. Some we know to cause or they have a high degree of possibility of causing nausea, and there are other chemotherapies that do not have such a high level of causing nausea and vomiting. So whether one experiences nausea and vomiting with their chemotherapy depends upon the kind of chemotherapy they're getting. It also depends on what kind of cancer they have. Some people, before they even start chemotherapy, are already experiencing problems with nausea, vomiting, abdominal pain, decreased appetite, inadequate nutrition, inadequate hydration. The first thing that will happen is you will be giving anti-nausea medication before you receive the chemotherapy, and then following receiving chemotherapy to have at home. I would urge you that should you have significant nausea and vomiting, even modest nausea and vomiting following your chemotherapy, that you contact your clinic. Most often, we are able to do something about that. Either come in and get treated, and/or a different anti-nausea medication may be prescribed for you, and you'll be able to just pick it up at your pharmacy. But in addition to the medication that will be prescribed to you, there are other things which we know are helpful as well with chemotherapy-induced nausea and vomiting. One, stay as well hydrated as you possibly can. It may mean that you're only able to take in small amounts of fluid at a time. So small glasses of water, Gatorade, ginger ale, whatever it is that you can get in. Once people become what we call volume depleted or dehydrated, it often makes them much more sensitive to having chemotherapy-induced nausea and vomiting. Some individuals, once their stomachs are empty, also have more of a sensitivity, becoming nauseous. Certain foods which you used to enjoy may now also cause either a sense of no longer tasting well, or may actually cause you to turn up your nose and feel queasy. So it becomes very important that one begins to identify those triggers which may cause nausea and vomiting and stay away from them. It can be smells, it can be sounds, things that you used to love, you may no longer find enjoyable. So one needs to stay away from those sorts of things. If you have nausea and vomiting while you're receiving chemotherapy, there are other reasons besides just having the chemotherapy. If one has a fever, we would be suspicious of an infection, and nausea and vomiting can be a sign of that. Sometimes some of the other medicines in and of themselves, which are entirely separate from the chemotherapy, can cause significant nausea and vomiting. So it can take a little while to sort out what the actual problem is. The other thing is, when people start receiving chemotherapy, we don't necessarily know which anti-nausea medicine will work best with that person. It's a matter of trial and error before we're able to really identify that which will work well. So it is very important that you tell very clearly and precisely the nurses and doctors who work with you how the anti-nausea medicines are working for you.